This is a letter for Mr. Johnson. Dear Prime Minister, my name is Dr. Tess Lawrie, and I'm the Director of the Evidence-Based Medicine Consultancy in Bath. My business conducts industry-independent medical evidence synthesis to support international clinical practice guidelines. My biggest clients are the National Health Service and the World Health Organization. I have recently authored a report called Ivermectin for Preventing and Treating COVID-19, a rapid review to validate the Frontline COVID-19 Critical Care Alliance's conclusions. In connection with its findings, I sent an urgent correspondence to Mr. Hancock and other members of Parliament on Monday, the 3rd of January. Unfortunately, I have not yet had a reply, and due to the urgent implications of the report, I'm trying to reach you via this video. The good news is that we now have solid evidence of an effective treatment for COVID-19. It is called ivermectin. Ivermectin is a very safe and effective anti-parasitic medication widely used in low and middle income countries to treat worms, lice, and scabies in both adults and children. It has been around for decades, and not only is it on the World Health Organization's list of essential medicines, it is a Nobel Prize-winning medicine due to its increasing usefulness across a range of different illnesses. Between Christmas and New Year, I independently reviewed 27 studies presented by the Frontline COVID-19 Critical Care Alliance as evidence of ivermectin's effectiveness. The resulting evidence is consistent and unequivocal. Ivermectin works well both in preventing COVID infections and in preventing deaths, at the same doses used to treat lice and other parasitic infections. I am very pleased to inform you that this evidence solidly substantiates the FLCCC's recommendation that ivermectin should be adopted globally and systematically for the prevention and treatment of COVID-19. Because I know there is a lot of fake news going about, I would like to assure you that you can trust the integrity of my report, because I'm an experienced independent medical research consultant whose work is routinely used to underpin international clinical practice guidelines. In addition, I have no conflict of interest and have received no funding for this report. But most of all, you can trust me because I am also a medical doctor, first and foremost, with a moral duty to help people, to do no harm, and to save lives. Please may we start saving lives now. Thank you very much for your help. Mr. Hancock's office should have my details.